Hello, my name is Brandon Owens, and I did my case study presentation on chronic traumatic encephalopathy. So I'd like to first start off by discussing what is chronic traumatic encephalopathy. It is a neurodegenerative disease associated with repetitive brain trauma or traumatic brain injury. It was medically discovered by Harrison S. Marlin in 1928 and it was called punch drunk and was later given the medical term dementia pigalustica. It was given the terminology punch drunk because it was commonly found in boxers after taking repetitive blows to the head. In 1960, it was dementia pigalustica was scientifically named chronic traumatic encephalopathy, and it was recently brought to the public by Dr. Minute Amalu in 2002. It is commonly found in contact sport athletes and military veterans. It is a result of multiple traumatic brain injuries or a concussion through through an individual's lifetime. Parkinson's disease and Alzheimer's disease are often associated with CTE because they share similar symptoms. So chronic traumatic encephalopathy is caused by multiple traumatic brain injuries, aka concussion, which is an external blow to the head causing either permanent or temporary brain damage affecting cognitive, behavioral, and physical functions, but is not only subjective to external blows to the head, it can also be caused by whiplash or anything that will cause the brain to move in the skull and crash against the outsides of the skull. A traumatic brain injury can differ in severity between mild, moderate, and severe. A mild traumatic brain injury results in no loss of consciousness, or loss of consciousness less than 30 minutes, and they'll have normal brain imaging. But a moderate or severe traumatic brain injury will result in loss of consciousness and will have abnormal brain imaging. A traumatic brain injury can cause a toxic protein called tau to be released in the brain, and they affect the microtubules of the axon that send nerve signals to the brain and affect our motor and our cognitive functions. So some signs and symptoms are CTE tend to affect individuals years after their traumatic brain injury. And individuals will experience deficits in their cognitive, behavioral, and physical functions. So some cognitive changes they may experience is lack of concentration, memory loss, decreased decision making, problem solving, and confusion. Behavioral changes they may experience is aggressive behavior, depression, irritability, impulsiveness, and suicidality. And some physical changes they may experience is headaches, loss of stamina, chronic pain, sleep disorders, and motor impairment. And similar findings of these symptoms are in patients or individuals with Alzheimer's disease, Parkinson's disease, post-traumatic stress disorder, or post-concussion syndrome. So CTE can only be diagnosed after death by an autopsy, and researchers are working on technology to be able to diagnose an individual with CTE while they're living. Researchers believe that technology used to diagnose a person with a traumatic brain injury can eventually be used to diagnose a person with CTE. But this is very difficult because symptoms of CTE don't usually happen until a few years later after a traumatic brain injury. So some technologies that are used to diagnose a person with traumatic brain injury is MRI or diffusion tensor imaging. And one technology that could possibly be used to diagnose people with CTE is a positron emission tomography, which is short for PET, which basically a tracer molecule is injected into the vein, which will show the tau deposits in the brain, which is seen in this bottom right picture. And of the little red spots, those are all tau deposits, which are an identifier of CTE. I did my case study on a 21-year-old collegiate football player. He plays strong safety and he has a desire to play in the NFL. Unfortunately for him, he suffered a concussion during the second week of his season during a head-to-head hit that left him unconscious for 30 seconds. In addition, this is his second traumatic brain injury he sustained in his lifetime. His first occurred in a high school football game during a similar incident with another head-to-head hit. He knows he could be a prospective draft pick if he is able to return to play before the end of the season. But days following his concussion, he described having symptoms of balance issues, difficulty concentrating, persistent fatigue, headaches, difficulty sleeping. He is concerned whether he will be cleared to play before the season is over, but he would like to continue to exercise in order to be physically prepared for return. So his height and weight is he's 6'1", 205 pounds, has a resting heart rate of 56 beats per minute, resting blood pressure of 120 over 70. LDLs are 83, HDLs are 62 milligrams per deciliter. BMI is 27, fasting glucose is 65, and he lives a non-sedentary lifestyle. He's a non-smoker, and his mother had a heart attack at age 62. So some precautions and special considerations for this client. His risk group classification, he's at low risk with 0 risk factors because he is less than age 45. His mother suffered a heart attack before age 65, which is a positive risk factor. He's a non-smoker. He's an athlete. His BMI is less than 30. His blood pressure is less than 140 over 90. His LDLs are less than 130 milligrams per deciliter. His HDLs are greater than 60 milligrams per deciliter, which is a negative risk factor, which cancels out the positive risk factor. So that's why he's at a low risk. And his fasting blood glucose is less than 126 milligrams per deciliter. So special considerations are that he gets plenty of rest. He reduces the intensity of physical activity if symptoms increase. He should include activities that challenge his balance within his exercise prescription. Do memory games or thinking activities to help rebuild his cognition. He should gradually increase exercise after clearance from a professional care provider, and make sure symptoms have completely subsided before returning back to the play to avoid second impact syndrome, which is one of the main causes of CTE. So he should also include some balance activities along with some cognitive games to restore his cognitive deficits and regain some of his stability. Since CTE cannot be treated, I would suggest that he avoid injuries to the head and possibly not return to play or just not further his career in football because he has a higher risk of possibly getting chronic traumatic encephalopathy. So as athletes who suffered traumatic brain injuries need to follow a 5-step process before returning to play. So it's kind of similar to my exercise prescription, but this 5-step process is mainly specific for contact sport athletes. And it basically just goes over it. It should start off with light aerobic activity, and then he should progress to moderate activity with some weightlifting involved. Then he can progress to heavy exercise and start non-contact practice. And then he can start practice and he can participate in practice with full contact. And then after he is cleared for that, he can start competition. And an athlete must be asymptomatic in each stage before moving to the next stage. So prevalence of CTE. So chronic traumatic encephalopathy is a prominent issue in our society. Researchers just continue to investigate the pathological mechanisms that lead to chronic traumatic encephalopathy. Our society is aware of the risk of developing CTE and the consequences of competing in contact sports, especially football. But it's not only subjected to football; it can also be boxing, hockey. And there's also CTE can also be diagnosed in patients who have suffered a car accident that had a brain injury. So some former NFL players that died, well, didn't that died and found to have CTE, which is a Junior Seau. He was a football player and he committed suicide by and they later found out that he had CTE after an autopsy. And Mike Webster, he was one of the first players they found to have CTE, and that was discovered by Dr. Bennett Amalu after he died of a heart attack at age 50. And they found a lot of traces of tau deposits in his brain, and it was a result of having CTE. And he played center for the Pittsburgh Steelers for 4 years. I mean, for 17 years, and won 4 Super Bowls with them. So a strategy must be made to make sports safer for individuals and lessen anxiety for athletes to compete in contact sports. And that is my references, and I like to conclude.